Hello everyone and welcome back to the channel. This is Doc ID and today another interesting topic. When do we discontinue precautions for COVID-19 at home? So right now, two ways. One is what we call a non-test based strategy, and the second one is what we call a test-based strategy. The non-test based strategy basically involves the improvement in symptoms and or a specific time interval, whereas the test-based strategy requires two negative PCR tests on a respiratory specimen collected more than 24 hours apart, especially for severely people who have had COVID-19. So for most patients with COVID-19, we're just going to use a non-test-based strategy. Previously, test-based strategies were routinely used, but now you know that these patients have persistent positive PCR tests for weeks to months after their symptoms have resolved, so it really becomes unnecessary and you cannot really take off anybody from quarantine in that case. So patients with confirmed infection. We do have evidence now that suggests that transmission most likely occurs during the early stages of infection and that isolation of infectious virus more than 10 days after the illness onset is rare in immunocompetent people who have actually improved after a non-severe infection. So if you are an immunocompetent person with mild to moderate disease, that means signs and symptoms of COVID-19 without hypoxia. Hypoxia means your oxygen saturation is more than 94% room air. The CDC states that home isolation can be discontinued with the following criteria. At least 10 days have passed since symptoms first appeared, and at least 1 day, that means 24 hours, has passed since resolution of fever without the use of fever-reducing medications such as Tylenol, Advil, etc. And there's improvement in your symptoms such as the cough is gone, shortness of breath is improved. So what about people who have a positive test but they have no symptoms at all? For those people, isolation can be discontinued when at least 10 days have passed since the date of your first positive COVID-19 test, as long as you don't develop any new illness or symptoms during those 10 days. If you do develop symptoms, then you got to do as what I outlined before with a symptom-based strategy as what I outlined above. What if you're immunocompromised? Well, patients, if you don't have non-severe disease, is pretty much the same strategy as what I outlined before for the immunocompetent people. However, if you're significantly immunocompromised, and that includes, for example, being 1 year within of having a stem cell or a solid organ transplant, for people with cancer receiving chemotherapy if we're actively on it, if you have HIV and have a CD4 count less than 200, any kind of immunodeficiency disorders, if you're on active steroids more than 20 milligrams per day for more than 2 weeks, then the CDC says that the duration of time from symptom onset to discontinuing this home quarantine be extended. The criteria for those patients are the following. At least 10 and up to 20 days have passed since your symptoms first appeared, and at least 1 day has passed since resolution of fever without using any fever-reducing medications. And there's again improvement in symptoms. For example, the cough and the shortness of breath goes away. Now, similarly, if you're severely immunocompromised and have a positive test, but again, no symptoms, then you continue home quarantine for at least 10 to 20 days have passed since the date of your first positive COVID-19 test, as long as you don't develop any kind of illness during that that 10 to 20 days. So that's basically what it outlines for the severely immunocompromised. So hopefully this gives you a good path to follow in case your family members or yourself get COVID-19, and what really you should be doing at home and when should you discontinue these precautions. Call your health department or even your physician, who can also kind of guide you at that time. So don't forget to comment or ask any questions that you have, and if you're interested in any other topics, please comment below. Don't forget to subscribe and again like the video.